Thank you for the kind introduction, Chair. And I'm very honored to be here today in IVHEM, and I also thank the organizers for giving me this opportunity today. What I brought today here is the current status of hepatitis C treatment and its barrier in my region in Jeonbuk State, Korea. This is actually a result of disease awareness campaign, which included also a part of survey portion for the hepatitis C patients. So I would like to start. Maybe I have to start with a brief introduction to the Jeonbuk State where the survey was underwent. The Jeonbuk State is located at the southwestern part of Korean Peninsula here. The population of the state is about 1.7 million and is about 3% of Korea's total population, and in area-wise, it's about 8% of Korea. So the population density is not much higher than other regions, and it's already the aging rate is already reached 25%. So it's a super aging society. And under the state, we have 6 cities and 8 counties, and the 58% of the total population was living in urban area. And for your information, I would like to show some hepatitis C statistics of Korea and also in the Jeonbuk State. So annually, we are receiving the notifications about 10,000 cases of new cases each year. The red lines, and the blue bars show the incidence cases of the Jeonbuk State. So we are seeing about 200, or slightly over the 200 cases every recent years. The trend is a little bit decreasing recently. So this is the awareness campaign. So we had a hepatitis C awareness campaign in the region. Actually, this was implemented through the partnership between the CASL, the Korea Association for the Study of Liver, and Jeonbuk State government. It was to improve the hepatitis C treatment rates in the region. So the primary aim of the campaign was to improve patient awareness of the disease and treatment options, and also provide treatment information to untreated patients. But also we tried to add some survey for in the campaign. So we also assessed the current status of treatment implementation for the hepatitis C patients notified through the National Notifiable Disease Surveillance System. So this is the overview of the survey. The campaign period was between July and September 2024, and the survey method was one-on-one telephone survey, and after that we provided some information through text messages. The survey subjects were 311 confirmed hepatitis C patients, and they were notified to the government between January 2023 to June 2024. This is the flowchart of the awareness campaign and the survey. So for the 311 hepatitis C patients, we contacted through the phone, and we tried interview, one-on-one interview. And first, we assessed the treatment status of the patient individually, and if they said they haven't cured or they were untreated, then we also asked the reasons for not receiving treatment. And once we completed the interview, and we sent the text messages about the hepatitis C prevention, and for those who said that they haven't treated yet, we also encouraged hepatitis C treatment with providing information on hepatitis C treatment clinics where they can find a hepatologist. So this is the result of the survey. So among the 311 hepatitis C patients, about 2/3 of the patients completed the survey. About 100 cases were excluded, either because they were diseased or unreachable. And the time between the notification of the patient to the government and the time of the survey was about 355 days, which is almost about 1 year. So this is, we can say that we assessed the treatment status 1 year after their diagnosis. So these are the general characteristics of the 208 respondents. About 2/3 of the respondents were female, and for the age distribution, over 30% were aged 80 or over. And for 60s and 70s, they were composed of, accounted for 20% each, and then the people aged less than 50s, they were about 1/4 of the total patients. This is the answer for the first question of the interview. So for the first question, we asked whether they have received the treatment for hepatitis C. 71% of the patients said yes, they received the treatment. So this was 148 patients. So for this 148 patients, we asked the second question: what type of treatment they received? But only 78% said that they received antivirals, and about 15% said they don't know. And 6.8% said they received hepatoprotectants, which is not the treatment for the hepatitis C virus. So for among the 208 cases, the treatment rate was 55% only. And then we asked the result of the treatment. 83% said they were cured, and 10% said they don't know, and 3% was under treatment, and failure or relapse cases was only 2%. And for the last question, we asked the reasons for not having received treatment. For those who said they haven't received treatment, or for the patients that they received treatment other than antivirals. So they were 92 patients. The most common answers for this was that they were asymptomatic. 25% said that the reason was they were asymptomatic, so they didn't think they need treatment. The second most reason was burden of medication cost. At the moment, in Korea, the patients have to pay about 3 million Korean won for hepatitis medication, which is about a little more than $2,000 US. So that it was burdensome for them. And another 20% said they were unaware that the treatment is necessary. And another 20% said they had some comorbidities, so it was not available to receive treatment. And I also think this 13% is also important, because they said they believe that the cure is impossible for hepatitis C. So these top 5 reasons for not having received treatment is very important. I categorized these reasons into three groups. So first would be these three reasons. So I can say this is due to lack of disease information. This accounted for 58%. And about 30% said they had limited access to healthcare services, including the economical barrier. And another 30% had personal condition issues. So in summary, the treatment rate remained at 55% for the first year after diagnosis, and failure or relapse after antiviral therapy was limited, and main barriers to treatment were lack of disease information and limited healthcare access, including economic burden and personal reasons. This is my last slide. So I would like to say that the hepatitis C treatment rate in Jeonbuk State is lower than the national average, with primary reason identified as lack of disease information. So this indicates the significant potential to improve treatment rates simply by providing accurate information to diagnose patients that treatment is necessary and cure is achievable. To achieve this, regional health authorities should implement individual patient management as part of national notified of disease control measures, thereby completing the care cascade. This approach would also align with decentralization principles. Additionally, given that the considerable number of patients expressed concerns about treatment costs, there is a need to establish financial support measures. And lastly, this survey represents the first quantitative analysis of hepatitis C treatment barriers in Korea, and I hope this will serve as evidence-based data for policy development at both central and local government levels. Thank you for your kind attention.